Medical Assistant Certification Exam Practice. Question 1. A provider asks for assistance because an infant arrives for a well-child visit. Which measurement is commonly documented in addition to weight and length? Option A, Snellen distance score. Option B, head circumference. Option C, waist to hip ratio. Option D, peak flow only. The correct answer is option B, head circumference. Head circumference is an important growth measurement for infants and helps monitor development over time. Waist ratios, peak flow values, and Snellen scores are not routine substitutes for infant growth tracking. Question 2. While following clinic policy, the medical assistant notes that orthostatic hypotension is suspected after a patient reports dizziness when standing during a realistic certification question. Which approach is appropriate? Option A, measure blood pressure and pulse after position changes according to protocol. Option B, ask the patient to jog briefly before measuring. Option C, measure temperature in 3 routes. Option D, take only a single seated blood pressure. The correct answer is option A, measure blood pressure and pulse after position changes according to protocol. Orthostatic assessment compares blood pressure and pulse across position changes to evaluate a possible drop with standing. A single seated reading, exertion before measurement, or unrelated temperature checks does not assess the suspected problem. Question 3. In a medical assistant certification review scenario, a temperature of 101.8 degrees Fahrenheit is obtained during intake for a patient in the exam room. How should this finding be handled? Option A, change it to normal if the patient denies illness. Option B, document the measured value as objective data and report it according to office protocol. Option C, wait until the end of the day to mention it. Option D, record that the patient feels feverish without the value. The correct answer is option B, document the measured value as objective data and report it according to office protocol. A measured temperature is objective data and should be recorded exactly as obtained. Replacing the value with a vague phrase, delaying a report, or changing the result would make the record inaccurate. Question 4. A medical assistant reviews a case where a medical assistant needs more detail about a patient's abdominal discomfort. Which question uses an open-ended interviewing technique? Option A, can you describe what the discomfort feels like? Option B, is the pain exactly a 5? Option C, you do not have nausea, correct? Option D, does it hurt, yes or no? The correct answer is option A, can you describe what the discomfort feels like? Open-ended questions invite the patient to describe symptoms in their own words and often reveal more complete information. Yes or no prompts, forced ratings, and leading questions limit the response and may miss important details. Question 5. In a medical assistant certification review scenario, a patient is being prepared for a 12-lead EKG while communicating with the care team. Which action improves electrode contact? Option A, apply lotion under each electrode. Option B, skip preparation if the patient is in a hurry. Option C, clean and dry the skin and remove excess hair if needed. Option D, place electrodes over heavy clothing. The correct answer is option C, clean and dry the skin and remove excess hair if needed. Clean, dry skin improves adhesion and electrical signal quality for EKG electrodes. Lotion, clothing, and skipped preparation can increase artifact or lead detachment. Question 6. When preparing safe patient care, a provider asks for an apical radial pulse comparison for a returning patient. Which method is appropriate? Option A, use pulse oximetry only and skip manual counting. Option B, subtract blood pressure from pulse rate. Option C, count radial pulse in the morning and apical pulse later. Option D, have 2 staff members count apical and radial pulses at the same time. The correct answer is option D, have 2 staff members count apical and radial pulses at the same time. An apical radial comparison requires simultaneous counts so a pulse deficit can be identified accurately. Separate timing, unrelated calculations, or relying only on a device does not measure the difference between heartbeats and peripheral pulses. Question 7. During a skills check, the scenario states that a pulse oximetry reading remains very low after the sensor is repositioned. Which action should the medical assistant take? Option A, tell the patient the reading is definitely normal. Option B, report the persistent abnormal reading promptly according to office protocol. Option C, wait until the next appointment to mention it. Option D, delete the result from the record. The correct answer is option B. Report the persistent abnormal reading promptly according to office protocol. A persistent abnormal oxygen saturation may signal impaired oxygenation and should be escalated promptly. Deleting results, falsely reassuring the patient, or delaying communication can place the patient at risk. Question 8. During a skills check, the scenario states that a patient has no known infection listed in the chart while following standard precautions. Which infection control approach still applies? Option A, skip hand hygiene when the patient appears healthy. Option B, wear sterile gloves for all administrative tasks. Option C, use airborne isolation for every routine visit. Option D, use standard precautions for every patient encounter. The correct answer is option D, use standard precautions for every patient encounter. Standard precautions assume that blood and body fluids may be infectious and apply to every patient. Appearance alone is not a safety guide, while universal airborne isolation or sterile gloves for non-sterile tasks is unnecessary and inefficient. Question 9. A medical assistant reviews a case where the medical assistant's hands are visibly soiled after cleaning a spill for a patient asking for clarification. Which method is preferred? Option A, put on a second pair of gloves over the soil. Option B, use hand sanitizer only. Option C, wipe hands on a paper towel. Option D, wash with soap and water. The correct answer is option D, wash with soap and water. Soap and water are preferred when hands are visibly soiled because mechanical washing removes material. Sanitizer alone, wiping without washing, or covering soil with gloves does not adequately clean the hands. Question 10. After confirming the patient's identity, a caller reports crushing chest pain and shortness of breath. Which response is appropriate? Option A, schedule a routine visit next month. Option B, diagnose indigestion over the phone. Option C, tell the caller to drive alone to the clinic. Option D, follow emergency protocol and direct the caller to emergency services as instructed by policy. The correct answer is option D, follow emergency protocol and direct the caller to emergency services as instructed by policy. Chest pain with shortness of breath may be an emergency and should be managed using established protocols. Delaying care, advising unsafe transport, or diagnosing by phone is outside the medical assistant role. Question 11. After confirming the patient's identity, a patient is suspected of having active tuberculosis while working under provider supervision. Which precaution is most appropriate? Option A, place the patient in the waiting room until closing. Option B, ask the patient to remove any mask to speak clearly. Option C, use only clean gloves. Option D, use airborne precautions with appropriate respiratory protection. The correct answer is option D, use airborne precautions with appropriate respiratory protection. Tuberculosis can spread through airborne particles, so respiratory protection and isolation procedures are needed. Gloves alone, extended waiting room exposure, or removing source control can increase transmission risk. Question 12. A medical assistant reviews a case where a reusable surgical instrument must be free of all microorganisms including spores for a patient scheduled for a procedure. Which process is required? Option A, plain water rinsing. Option B, routine dusting. Option C, sanitization only. Option D, sterilization. The correct answer is option D, sterilization. Sterilization destroys all forms of microbial life including spores when performed correctly. Sanitizing, dusting, or rinsing lowers visible soil or some organisms but does not make an instrument sterile. Question 13. While following clinic policy, the medical assistant notes that instruments are removed from the autoclave after a cycle. Which finding supports that the sterilization process should be reviewed before use? Option A, the instrument pack is labeled with the date. Option B, the package is dry and intact. Option C, the chemical indicator has not changed as expected. Option D, the load has a completed log entry. The correct answer is option C, the chemical indicator has not changed as expected. A failed chemical indicator suggests the sterilization conditions may not have been met and the load should not be used until evaluated. Dry packaging, completed logs, and date labeling are expected quality control elements rather than failure signs. Question 14. While reviewing office protocol, A disinfectant splashes onto the counter and the medical assistant needs spill guidance while following standard precautions. Which resource gives chemical handling information? Option A, growth chart. Option B, safety data sheet. Option C, the appointment ledger. Option D, insurance aging report. The correct answer is option B, safety data sheet. A safety data sheet explains hazards, personal protective equipment, spill response, and first aid information for chemicals. Scheduling, billing, and growth records do not provide chemical safety instructions. Question 15. When preparing safe patient care, two patients are placed in the same appointment slot for an older adult. What is this called? Option A, closed filing. Option B, capillary puncture. Option C, downcoding only. Option D, double booking. The correct answer is option D, double booking. Double booking schedules more than one patient in the same time slot and should be used carefully according to policy. Capillary puncture, filing, and downcoding are unrelated terms. Question 16. While rooming a patient waiting for the provider is involved when a patient reports a severe latex allergy before rooming. Which action is appropriate? Option A, ignore the report unless a rash is visible. Option B, document the allergy only after the visit. Option C, use powdered latex gloves for a better fit. Option D, use latex-free supplies and alert the care team. The correct answer is option D, use latex-free supplies and alert the care team. Latex allergy can cause serious reactions, so latex-free supplies and team awareness are important before care begins. Ignoring the report, using latex products, or delaying documentation can expose the patient to harm. Question 17. While following clinic policy, the medical assistant notes that a used venipuncture needle is ready for disposal while working under provider supervision. Which practice is safest? Option A, avoid recapping and dispose of it immediately in a sharps container. Option B, break the needle before disposal. Option C, place it in a coat pocket until the room is cleaned. Option D, recap with both hands to prevent leakage. The correct answer is option A, avoid recapping and dispose of it immediately in a sharps container. Avoiding recapping and placing sharps directly into the proper container reduces needle stick risk. Two-handed recapping, breaking needles, or carrying sharps in pockets are unsafe practices. Question 18. For a patient with a routine complaint in an outpatient setting, an exam room is being disinfected between patients for a patient with a routine complaint. Which workflow is most appropriate? Option A, start with the trash and then clean the clean supplies. Option B, clean from less contaminated areas toward more contaminated areas. Option C, use the same wipe until it is visibly dry and dirty. Option D, disinfect only areas the patient mentions touching. The correct answer is option B, clean from less contaminated areas toward more contaminated areas. Cleaning from cleaner to dirtier areas helps prevent spreading contamination back onto cleaner surfaces. Starting with trash, overusing wipes, or cleaning only reported contact points leaves avoidable contamination. Question 19. At a community health clinic, a patient asking for clarification is involved when a coagulation study such as patient or INR is ordered. Which tube is typically used? Option A, gray sodium fluoride tube. Option B, light blue sodium citrate tube. Option C, lavender EDTA tube. Option D, yellow acid citrate dextrose tube. The correct answer is option B, light blue sodium citrate tube. Light blue tubes contain sodium citrate and are commonly used for coagulation testing. EDTA, fluoride, and acid citrate dextrose tubes have different additives and are used for other laboratory purposes. Question 20. A medical assistant reviews a case where a blood specimen label is about to be placed on a tube after confirming office policy. Which action best prevents patient identification errors? Option A, verify two identifiers such as full name and date of birth before labeling. Option B, ask another patient to confirm the name. Option C, use the room number as the only identifier. Option D, label the tube after returning to the desk. The correct answer is option A, verify two identifiers such as full name and date of birth before labeling. Two identifiers reduce the risk of assigning results to the wrong patient and should be checked before specimen labeling. Room numbers, delayed labeling, and unrelated confirmation are unsafe because they can lead to misidentification. Question 21. While training a new medical assistant, a patient with a routine complaint is involved when a tourniquet has been applied while locating a vein for a patient with a routine complaint. Which practice helps prevent hemoconcentration? Option A, tighten it after blood begins flowing. Option B, release the tourniquet within about 1 minute when possible. Option C, leave it on until all paperwork is complete. Option D, apply it over broken skin for grip. The correct answer is option B. Release the tourniquet within about 1 minute when possible. Prolonged tourniquet application can concentrate blood components and affect results. Leaving it on too long, tightening it unnecessarily, or placing it over broken skin can harm the patient or compromise the specimen. Question 22. While following clinic policy, the medical assistant notes that a vein tends to roll during palpation. Which action can improve venipuncture control? Option A, tap the needle against the vein repeatedly. Option B, use the thumb above the puncture site. Option C, ask the patient to pump the fist throughout the draw. Option D, anchor the vein by pulling the skin taut below the site. The correct answer is option D, anchor the vein by pulling the skin taut below the site. Anchoring below the puncture site helps stabilize the vein and improves control. Placing the thumb above the site, repeated tapping with the needle, or ongoing fist pumping can be unsafe or affect specimen quality. Question 23. At the front desk handoff, a teen patient is involved when an additive tube has just filled during venipuncture during a realistic certification question. Which action is appropriate? Option A, set it aside without mixing. Option B, invert the tube gently the recommended number of times. Option C, shake it hard until foam appears. Option D, open the tube and stir it with a swab. The correct answer is option B, invert the tube gently the recommended number of times. Additive tubes need gentle inversion to mix blood with the additive and prevent clotting or testing errors. Shaking, failing to mix, or opening tubes creates specimen problems and exposure risk. Question 24. During a follow-up visit, a returning patient is involved when a urine drug screen requires legal chain of custody handling for a returning patient. Which action is essential? Option A, leave the specimen unlabeled in the bathroom. Option B, let the patient take the specimen home overnight. Option C, use a routine sticky note instead of required forms. Option D, document specimen control and signatures at each transfer. The correct answer is option D, document specimen control and signatures at each transfer. Chain of custody documents who handled the specimen and helps preserve legal validity. Unlabeled storage, patient transport outside protocol, or informal notes break the required control process. Question 25. During a walk-in visit, a patient with hypertension is involved when a patient describes dysuria. What does dys usually indicate? Option A, without. Option B, normal. Option C, difficult or painful. Option D, after meals. The correct answer is option C, difficult or painful. Dys often means difficult, painful, or abnormal, so dysuria is painful or difficult urination. Normal, without, and after meals are represented by different word parts. Question 26. While following clinic policy, the medical assistant notes that a patient asks what hemoglobin A1C reflects during clinical workflow. Which explanation is most accurate? Option A, kidney function during the last hour. Option B, white blood cell count after infection. Option C, average blood glucose control over roughly the past 2 to 3 months. Option D, blood oxygen level at this exact moment. The correct answer is option C, average blood glucose control over roughly the past 2 to 3 months. Hemoglobin A1C reflects long-term glucose exposure over the lifespan of red blood cells. It is not a real-time oxygen, kidney, or white blood cell measurement. Question 27. In a medical assistant certification review scenario, a throat culture is being collected for suspected strep throat for a patient waiting for the provider. Which technique is appropriate? Option A, swab the tonsillar area and posterior pharynx while avoiding the tongue and cheeks. Option B, swab only the outer lips. Option C, touch the swab to the tongue repeatedly. Option D, dip the swab in tap water before collection. The correct answer is option A, swab the tonsillar area and posterior pharynx while avoiding the tongue and cheeks. The tonsillar area and posterior pharynx are the target sites for a throat culture. Swabbing lips, contaminating with tongue contact, or adding tap water can reduce specimen quality. Question 28. Before documenting in the chart, a patient with diabetes is involved when a capillary puncture is needed for an adult patient. Which site is generally preferred? Option A. A swollen infected fingertip. Option B. The side of the distal segment of the middle or ring finger. Option C. The earlobe for every adult test. Option D. The center of the thumb pad. The correct answer is option B. The side of the distal segment of the middle or ring finger. The side of the distal middle or ring finger is commonly used because it provides blood flow while reducing injury risk. Thumb punctures, routine earlobe use, and infected sites are not preferred for standard adult finger sticks. Question 29. After confirming the patient's identity, a tube label and requisition do not match while preparing for provider review. Which action is most appropriate? Option A. Guess which name is correct. Option B. Stop processing and resolve the discrepancy according to policy. Option C. Send it to the lab without comment. Option D. Scratch out the name and keep going. The correct answer is option B. Stop processing and resolve the discrepancy according to policy. Label and requisition mismatches create serious patient identification risk and must be resolved before processing. Guessing, altering labels casually, or sending the specimen without correction can produce dangerous errors. Question 30. A provider asks for assistance because Medicare may not cover a service and the patient must be informed before it is performed for a patient with a routine complaint. Which form may be needed? Option A. Daily appointment reminder card. Option B. Bloodborne pathogen log. Option C. Advanced beneficiary notice. Option D. Pediatric growth chart. The correct answer is option C. Advanced beneficiary notice. An advanced beneficiary notice informs a Medicare patient that a service may not be covered and that they may be financially responsible. Exposure logs, growth charts, and reminder cards do not serve this financial notice purpose. Question 31. While following clinic policy, the medical assistant notes that a patient is being prepared for a 12-lead EKG. Which action improves electrode contact? Option A. Skip preparation if the patient is in a hurry. Option B. Apply lotion under each electrode. Option C. Place electrodes over heavy clothing. Option D. Clean and dry the skin and remove excess hair if needed. The correct answer is option D. Clean and dry the skin and remove excess hair if needed. Clean, dry skin improves adhesion and electrical signal quality for EKG electrodes. Lotion, clothing, and skipped preparation can increase artifact or lead detachment. Question 32. During a geriatric visit, a chest lead is being placed during a 12-lead EKG while working under provider supervision. Where should V2 be positioned? Option A. 5th intercostal space at the left midclavicular line. Option B. 4th intercostal space at the left sternal border. Option C. Right lower abdomen. Option D. A 4th intercostal space at the right sternal border. The correct answer is option B. 4th intercostal space at the left sternal border. V2 belongs at the 4th intercostal space on the left sternal border. Right sternal placement is V1, 5th intercostal midclavicular placement is V4, and the right lower abdomen is a limb lead area. Question 33. In a medical assistant certification review scenario, an EKG tracing shows irregular spikes while the patient talks and moves for a patient with limited mobility. Which action should the medical assistant take? Option A. Ask the patient to relax, remain still, and avoid talking during the recording. Option B. Move electrodes randomly until spikes disappear. Option C. Ignore the artifact and file the tracing. Option D. Increase room noise so the patient relaxes. The correct answer is option A. Ask the patient to relax, remain still, and avoid talking during the recording. Movement and muscle activity can create artifact that interferes with interpretation. Noise, random lead movement, or ignoring the artifact does not correct the signal problem. Question 34. While following clinic policy, the medical assistant notes that a patient asks what a 12-lead EKG records. Which response is accurate? Option A. It injects dye into the coronary arteries. Option B. It directly measures lung volume. Option C. It measures blood glucose through the skin. Option D. It records electrical activity of the heart from multiple views. The correct answer is option D. It records electrical activity of the heart from multiple views. A 12-lead EKG displays the heart's electrical activity from different lead perspectives. It is not a glucose test, pulmonary function test, or invasive dye study. Question 35. A provider asks for assistance because an intramuscular injection is ordered in the deltoid site while prioritizing patient safety. Which action supports safety? Option A. Identify the correct landmark and avoid injecting too low on the arm. Option B. Inject directly into the elbow crease. Option C. Choose the site through clothing. Option D. Use the same site repeatedly without assessment. The correct answer is option A. Identify the correct landmark and avoid injecting too low on the arm. Correct landmarking helps place the medication in muscle and reduces risk of nerve or tissue injury. The elbow crease, injection through clothing, or repeated use without assessment are unsafe techniques. Question 36. While rooming a patient, a provider asks whether a tracing has a basic sinus pattern for a patient scheduled for a procedure. Which feature supports that pattern? Option A. AP wave before each QRS complex with a consistent rhythm. Option B. No relationship between atrial and ventricular activity. Option C. A missing QRS after every beat. Option D. A random spikes caused by loose leads. The correct answer is option A. AP wave before each QRS complex with a consistent rhythm. Sinus rhythm generally includes AP wave before each QRS complex with consistent conduction. Missing QRS complexes, artifact spikes, or unrelated atrial and ventricular activity do not support a simple sinus pattern. Question 37. Before documenting in the chart, a patient is cold and shivering during an EKG. Which artifact is most likely? Option A. Muscle artifact that makes the tracing appear noisy. Option B. A normal calibration mark only. Option C. A blood pressure cuff leak. Option D. A guaranteed myocardial infarction. The correct answer is option A. Muscle artifact that makes the tracing appear noisy. Shivering creates muscle activity that can make the tracing noisy and difficult to interpret. It should not be assumed to be a heart attack, a cuff problem, or only a calibration mark. Question 38. During a clinical skills check, a patient needs the chest exposed for electrode placement during clinical workflow. Which action protects dignity? Option A. Discuss the patient's body in the hallway. Option B. Ask unrelated staff to watch the setup. Option C. Leave the door open for airflow. Option D. Use draping and expose only the areas needed for electrode placement. The correct answer is option D. Use draping and expose only the areas needed for electrode placement. Draping and limited exposure protect privacy while allowing accurate electrode placement. Open doors, unnecessary observers, and hallway comments violate dignity and confidentiality. Question 39. During a skills check, the scenario states that a medication is about to be administered in the clinic for a patient asking for clarification. Which check is part of safe medication administration? Option A. Document before the patient receives the medication. Option B. Skip allergy review if the patient is a regular visitor. Option C. Verify the right patient, medication, dose, route, time, and documentation. Option D. Give the dose if the medication name sounds familiar. The correct answer is option C. Verify the right patient, medication, dose, route, time, and documentation. The medication rights reduce errors by confirming key elements before and after administration. Familiar names, early documentation, and skipped allergy review can create preventable medication mistakes. Question 40. While following clinic policy, the medical assistant notes that a controlled medication is stored in the clinic. Which practice supports accountability? Option A. Keep it unlocked for convenience. Option B. Estimate the count once a year. Option C. Document receipt, administration, waste, and remaining count according to policy. Option D. Let patients sign it out themselves. The correct answer is option C. Document receipt, administration, waste, and remaining count according to policy. Controlled substances require strict documentation and secure handling to prevent diversion and errors. Unlocked storage, infrequent estimates, or patient self-checkout would break accountability requirements. Question 41. While following clinic policy, the medical assistant notes that a tuberculin skin test is being administered during a quality control check. Which technique is appropriate? Option A. Apply heat to spread the medication. Option B, massage the site hard after injection. Option C, inject deeply into the gluteal muscle. Option D, insert the needle shallowly with the bevel up to create a small wheal. The correct answer is option D. Insert the needle shallowly with the bevel up to create a small wheal. An intradermal test is placed just under the epidermis and should create a small wheal. Deep injection, massage, or heat can alter the test placement and interfere with reading. Question 42. A provider asks for assistance because insulin is prescribed in units for a pediatric patient. Which equipment is appropriate for measuring it? Option A. A tuberculin syringe marked only in milliliters without conversion. Option B. A medicine cup for tablets. Option C. An insulin syringe calibrated in units. Option D. A household teaspoon. The correct answer is option C. An insulin syringe calibrated in units. Insulin syringes are specifically calibrated in units to match insulin dosing. Household spoons, unconverted milliliter markings, and tablet cups do not provide safe insulin measurement. Question 43. In a medical assistant certification review scenario, a patient asks why pulse may be checked before taking a beta blocker. Which explanation is accurate? Option A. Beta blockers can lower heart rate and blood pressure. Option B. They are used only as antibiotics. Option C. They always raise blood glucose immediately. Option D. They make pulse checks unnecessary. The correct answer is option A. Beta blockers can lower heart rate and blood pressure. Beta blockers commonly reduce heart rate and blood pressure, making pulse assessment clinically relevant. They are not antibiotics, do not always raise glucose immediately, and do not eliminate the need for monitoring. Question 44. A medical assistant reviews a case where a patient taking furosemide asks why urination has increased during a quality control check. Which explanation is most accurate? Option A. Diuretics help the body remove excess fluid through urine. Option B. Diuretics stop kidney filtration completely. Option C. Diuretics are vaccines against infection. Option D. Diuretics are used only for pain relief. The correct answer is option A. Diuretics help the body remove excess fluid through urine. Furosemide is a diuretic that increases fluid and electrolyte excretion through the kidneys. It does not stop filtration, function as a vaccine, or serve only as an analgesic. Question 45. During a skills check, the scenario states that a coagulation study such as patient or INR is ordered for a patient with diabetes. Which tube is typically used? Option A. Yellow acid citrate dextrose tube. Option B. Gray sodium fluoride tube. Option C. Lavender EDTA tube. Option D. Light blue sodium citrate tube. The correct answer is option D. Light blue sodium citrate tube. Light blue tubes contain sodium citrate and are commonly used for coagulation testing. EDTA, fluoride, and acid citrate dextrose tubes have different additives and are used for other laboratory purposes. Question 46. During a skills check, the scenario states that a handwritten order uses the abbreviation U for units. Which action is safest? Option A. Clarify the order because you can be misread. Option B. Change it to milligrams without asking. Option C. Ignore the abbreviation and give any dose. Option D. Assume U means unlimited refills. The correct answer is option A. Clarify the order because you can be misread. The abbreviation U can be mistaken for a zero or other marking, so clarification prevents dosing errors. Guessing, changing units, or giving an arbitrary dose is unsafe. Question 47. A provider asks for assistance because a patient asks whether to stop an antibiotic once symptoms improve before documentation is completed. Which instruction is generally appropriate? Option A. Stop immediately when feeling better every time. Option B. Save the rest for a family member. Option C. Follow the prescribed course and contact the provider before stopping early. Option D. Double the next dose to finish faster. The correct answer is option C. Follow the prescribed course and contact the provider before stopping early. Antibiotics should be taken as prescribed unless the provider changes the plan, which helps treatment success and stewardship. Stopping early, sharing medication, or doubling doses can be unsafe and ineffective. Question 48. After confirming the patient's identity, an order is for 500 milligrams and the available tablets are 250 milligrams each for a patient waiting for the provider. How many tablets are needed? Option A, 4 tablets. Option B, 10 tablets. Option C, 0.5 tablet. Option D, 2 tablets. The correct answer is option D, 2 tablets. Dividing the ordered dose of 500 mg by 250 mg per tablet gives 2 tablets. The other amounts would provide too little or too much medication. Question 49. In a medical assistant certification review scenario, a vaccine is administered in the clinic. Which detail should be documented? Option A, vaccine name, lot number, expiration date, site, route, and patient response is required. Option B, only the patient's favorite pharmacy. Option C, a guess at the manufacturer if the label is missing. Option D, the weather outside the clinic. The correct answer is option A. Vaccine name, lot number, expiration date, site, route, and patient response is required. Vaccine documentation supports traceability, safety monitoring, and legal requirements. Pharmacy preference, weather, and guest manufacturer details do not replace required vaccine records. Question 50. In a medical assistant certification review scenario, a patient receives a statement from insurance showing allowed charges and payments while preventing documentation errors. What is this document called? Option A, explanation of benefits. Option B, advance directive. Option C, prescription label. Option D, incident report. The correct answer is option A, explanation of benefits. An explanation of benefits summarizes how an insurance claim was processed and what may be owed. Advance directives, incident reports, and prescription labels serve different purposes. Question 51. While preparing the exam room, a patient's blood glucose is described as hyperglycemic for a patient with hypertension. What does the prefix hyper indicate? Option A, below normal. Option B, without pain. Option C, around the heart. Option D, high or excessive. The correct answer is option D, high or excessive. Hyper means high or excessive, so hyperglycemia refers to elevated blood glucose. Below normal, around the heart, and without pain are represented by different word parts. Question 52. A medical assistant reviews a case where a chart lists hypertension as a chronic condition. Which finding is associated with this diagnosis? Option A, persistently elevated blood pressure. Option B, low body temperature. Option C, inflamed tonsils. Option D, low blood oxygen only. The correct answer is option A, persistently elevated blood pressure. Hypertension refers to blood pressure that remains elevated over time. Oxygen saturation, tonsil inflammation, and temperature changes describe different clinical problems. Question 53. While rooming a patient uses a rescue inhaler during episodes of wheezing after noticing a potential safety concern. Which process is commonly involved in asthma? Option A, excess bone growth in the femur. Option B, bronchoconstriction and airway inflammation. Option C, failure of the eardrum to vibrate. Option D, loss of tooth enamel only. The correct answer is option B, bronchoconstriction and airway inflammation. Asthma commonly involves narrowed inflamed airways that can cause wheezing and shortness of breath. Bone growth, eardrum movement, and tooth enamel loss do not explain asthma symptoms. Question 54. When preparing safe patient care, a patient asks which organ produces insulin for a patient with limited mobility. Which organ should be identified? Option A, spleen. Option B, thyroid cartilage. Option C, gallbladder. Option D, pancreas. The correct answer is option D, pancreas. The pancreas contains cells that produce insulin for blood glucose regulation. The spleen, gallbladder, and thyroid cartilage do not produce insulin. Question 55. A provider asks for assistance because a conscious diabetic patient is shaky and has a low glucose reading. Which action is generally appropriate by protocol? Option A, administer a random antibiotic. Option B, tell the patient to exercise vigorously. Option C, provide a fast-acting carbohydrate if allowed by office policy. Option D, give nothing and send the patient to drive home. The correct answer is option C, provide a fast-acting carbohydrate if allowed by office policy. A conscious patient with low glucose may need fast-acting carbohydrate according to protocol. Driving, antibiotics, or vigorous exercise can worsen the situation or fail to treat hypoglycemia. Question 56. A provider asks for assistance because a procedure name ends in ectomy while prioritizing patient safety. What does the suffix mean? Option A, surgical removal. Option B, paralysis. Option C, inflammation. Option D, enlargement. The correct answer is option A, surgical removal. Ectomy means surgical removal, such as appendectomy. Inflammation, paralysis, and enlargement use different suffixes. Question 57. While following clinic policy, the medical assistant notes that the word gastroscopy contains gastro/o for a patient who appears anxious. What body part is referenced? Option A, bladder. Option B, stomach. Option C, nerve. Option D, lung. The correct answer is option B, stomach. Gastro/o refers to the stomach and appears in terms involving gastric structures or procedures. Lung, nerve, and bladder use different combining forms. Question 58. When preparing safe patient care, a rash is described as proximal to the wrist. What does proximal mean? Option A, on the back side only. Option B, farther from the trunk. Option C, toward the skin surface. Option D, closer to the trunk or point of attachment. The correct answer is option D, closer to the trunk or point of attachment. Proximal means closer to the trunk or the point where a limb attaches. Distal, posterior, and superficial refer to different anatomical directions. Question 59. While following clinic policy, the medical assistant notes that a patient is lying flat on the back for an exam after reviewing the order. Which position is this? Option A, supine. Option B, prone. Option C, SIMS. Option D, lithotomy. The correct answer is option A, supine. Supine means lying face up on the back. Prone is face down, lithotomy uses stirrups, and SIMS is a side-lying position. Question 60. For a patient with a routine complaint in an outpatient setting, a medication list includes atorvastatin for a patient with a routine complaint. Which medication class does this represent? Option A, anticoagulant used to dissolve clots instantly. Option B, a bronchodilator used for acute wheezing only. Option C, statin used to lower cholesterol. Option D, diuretic used to increase urine output. The correct answer is option C, statin used to lower cholesterol. Atorvastatin is a statin used to help manage cholesterol levels. Diuretics, anticoagulants, and bronchodilators have different purposes and mechanisms. Question 61. A provider asks for assistance because a patient has low hemoglobin and complains of fatigue. Which condition is being described? Option A, anemia. Option B, dermatophyte infection. Option C, hypertension. Option D, appendicitis. The correct answer is option A, anemia. Anemia involves reduced hemoglobin or red blood cell capacity and can cause fatigue or weakness. Appendicitis, hypertension, and fungal skin infection do not describe low hemoglobin. Question 62. While assisting with patient care, a patient with a routine complaint is involved when a staff member asks for a patient's full chart to answer a simple billing question during a realistic certification question. Which HIPAA principle applies? Option A, use only the minimum necessary information to complete the task. Option B, post the details in the waiting room. Option C, share the entire chart because staff are curious. Option D, send the chart to a friend for advice. The correct answer is option A, use only the minimum necessary information to complete the task. The minimum necessary standard limits access and disclosure to what is needed for the job task. Curiosity, public posting, or sharing outside the care team violates privacy expectations. Question 63. During a routine office visit, an insurance plan must approve a medication before it is dispensed for a patient asking for clarification. What process is being requested? Option A, prior authorization. Option B, waive scheduling. Option C, coinsurance posting. Option D, alphabetic indexing. The correct answer is option A, prior authorization. Prior authorization is payer approval required before certain medications or services are covered. Coinsurance, scheduling style, and filing order are separate administrative concepts. Question 64. A medical assistant reviews a case where a patient receives a statement from insurance showing allowed charges and payments. What is this document called? Option A, incident report. Option B, advance directive. Option C, prescription label. Option D, explanation of benefits. The correct answer is option D, explanation of benefits. An explanation of benefits summarizes how an insurance claim was processed and what may be owed. Advanced directives, incident reports, and prescription labels serve different purposes. Question 65. A provider asks for assistance because a patient has a small foreign material exposure in the eye while following standard precautions. Which action is appropriate before irrigation? Option A, ignore contact lenses and begin forcefully. Option B, apply random medication drops without order. Option C, use a dry cotton swab across the cornea. Option D, check the order or protocol and use appropriate solution and protection. The correct answer is option D, check the order or protocol and use appropriate solution and protection. Eye irrigation should follow protocol with correct solution and care to prevent injury. Dry swabbing, unadhered medication, or forceful technique can damage the eye. Question 66. A medical assistant reviews a case where a claim needs a code for the patient's diagnosis for a new patient. Which code set is used? Option A, HCPCS Level 2 only. Option B, ICD-10-CM. Option C, CPT only. Option D, NDC only. The correct answer is option B, ICD-10-CM. ICD-10-CM codes describe diagnoses and reasons for encounters. CPT, HCPCS Level 2, and NDC identify procedures, supplies, or drug products rather than diagnoses. Question 67. A provider asks for assistance because a claim includes durable medical equipment supplied to a patient. Which code set may be used? Option A, only the patient's zip code. Option B, HCPCS Level 2. Option C, the provider's lunch schedule. Option D, a pain rating scale. The correct answer is option B, HCPCS Level 2. HCPCS Level 2 codes are commonly used for supplies, equipment, and some services not fully described by CPT. Zip codes, schedules, and pain scales are not coding systems for durable medical equipment. Question 68. While rooming a patient, a new patient is involved when a provider marks diagnoses and services after the visit for billing during the visit. Which document is often used? Option A, suture package. Option B, superbill or encounter form. Option C, electrode tab. Option D, autoclave pouch. The correct answer is option B, superbill or encounter form. A superbill or encounter form captures visit services and diagnoses for billing workflow. Sterilization pouches, suture packages, and electrode tabs are clinical supplies rather than billing documents. Question 69. At the front desk handoff, an outside attorney requests a copy of a patient's medical record for a returning patient. Which action is generally required before release? Option A, give only verbal gossip about the visit. Option B, to obtain a valid authorization or follow a permitted legal process. Option C, post the record in the portal without checking identity. Option D, send the record because the attorney sounds official. The correct answer is option B, obtain a valid authorization or follow a permitted legal process. Medical records generally require patient authorization or a valid legal basis before disclosure. Official-sounding requests, unchecked portal release, and informal gossip violate confidentiality. Question 70. During a morning clinic session, a patient scheduled for a procedure is involved when a term contains the combining form cardi/O. Which body structure is referenced? Option A, kidney. Option B, skin. Option C, stomach. Option D, heart. The correct answer is option D, heart. Cardi/O refers to the heart and appears in terms such as cardiology and cardiogram. Kidney, stomach, and skin use different word parts. Question 71. A medical assistant reviews a case where several patients are scheduled at the beginning of the hour and seen in order of arrival or need after noticing a potential safety concern. Which system is this? Option A, wave scheduling. Option B, pulse deficit scheduling. Option C, sterilization cycle. Option D, double entry bookkeeping. The correct answer is option A, wave scheduling. Wave scheduling brings multiple patients in during a time block to manage provider flow. Bookkeeping, sterilization, and pulse comparison are unrelated concepts. Question 72. During a skills check, The scenario states that a patient misses a scheduled appointment without canceling for a patient scheduled for a procedure. Which action is appropriate? Option A, delete the appointment from the record. Option B, document the no-show and follow office policy for follow-up. Option C, bill any random amount without policy. Option D, discuss the patient publicly in the waiting room. The correct answer is option B, document the no-show and follow office policy for follow-up. No-shows should be documented and handled consistently according to office policy. Deleting records, arbitrary billing, or public discussion creates administrative and privacy problems. Question 73. In a medical assistant certification review scenario, a patient requests correction of information in the medical record. Which action is appropriate? Option A, change another patient's chart instead. Option B, erase the original entry without documentation. Option C, tell the patient records can never be reviewed. Option D, follow the facility process for an amendment or addendum. The correct answer is option D, follow the facility process for an amendment or addendum. Medical records are corrected through formal amendment or addendum processes that preserve integrity. Erasing entries, refusing all review, or altering the wrong chart is improper. Question 74. A medical assistant reviews a case where a billing call is made about an overdue balance while preventing documentation errors. Which practice protects privacy? Option A, leave detailed diagnosis information on a shared voicemail. Option B, discuss the balance with anyone who answers. Option C, verify the patient's identity before discussing account details. Option D, announce the debt in the waiting room. The correct answer is option C, verify the patient's identity before discussing account details. Identity verification helps protect financial and health information during billing conversations. Sharing details with unknown persons, detailed shared voicemail, or public announcements violates privacy. Question 75. A provider asks for assistance because a procedure is performed after the patient clearly refuses touching for a patient with limited mobility. Which legal concern may apply? Option A, defamation only. Option B, capitation. Option C, battery. Option D, abandonment only. The correct answer is option C, battery. Battery involves unauthorized physical contact and can occur when touching continues after refusal. Defamation, abandonment, and capitation refer to different legal or payment concepts. Question 76. In a medical assistant certification review scenario, a procedure is performed after the patient clearly refuses touching. Which legal concern may apply? Option A, defamation only. Option B, abandonment only. Option C, battery. Option D, capitation. The correct answer is option C, battery. Battery involves unauthorized physical contact and can occur when touching continues after refusal. Defamation, abandonment, and capitation refer to different legal or payment concepts. Question 77. For a patient who appears anxious in an outpatient setting, a clinic may be liable for an employee's actions within job duties while working under provider supervision. Which doctrine is described? Option A, deductible carryover. Option B, respondeat superior. Option C, informed refusal. Option D, homeostasis. The correct answer is option B, respondeat superior. Respondeat superior means an employer may be responsible for certain employee actions performed within the scope of employment. The other terms describe consent, insurance, or physiology rather than employer liability. Question 78. After confirming the patient's identity, a patient has written instructions about future medical care if unable to speak for a patient in the exam room. Which document is this? Option A, daily deposit slip. Option B, super bill. Option C, autoclave indicator. Option D, advance directive. The correct answer is option D, advance directive. An advance directive communicates care preferences for future situations when the patient may be unable to decide. Billing, sterilization, and deposit documents do not express medical wishes. Question 79. A provider asks for assistance because a patient uses a traditional health practice unfamiliar to the medical assistant. Which response is best? Option A, ridicule the practice in the chart. Option B, tell the patient to stop without provider input. Option C, ask respectful, non-judgmental questions and share relevant information with the provider. Option D, ignore it even if it may affect care. The correct answer is option C. Ask respectful, non-judgmental questions and share relevant information with the provider. Cultural competence involves respectful curiosity and accurate communication that supports safe care. Ridicule, unsupported instructions, or ignoring relevant practices can damage trust and miss safety issues. Question 80. During a skills check, the scenario states that a blood pressure reading is being prepared for an adult with a large upper arm after reviewing the order. Which action supports the most accurate result? Option A, place the cuff over the sleeve for comfort. Option B, deflate the cuff as rapidly as possible. Option C, use the smallest cuff to keep it snug. Option D, select a cuff with a bladder size appropriate for the arm circumference. The correct answer is option D. Select a cuff with a bladder size appropriate for the arm circumference. Correct cuff size keeps the pressure reading closer to the patient's true blood pressure because an undersized cuff can falsely elevate the value. Measuring over clothing, choosing equipment for convenience, or deflating too quickly can distort the reading and lead to poor clinical decisions. Question 81. A provider asks for assistance because a patient says they are scared about a biopsy result for a teen patient. Which response is therapeutic? Option A. Everyone gets scared, so stop worrying. Option B. You should not ask questions. Option C. That sounds frightening. I can let the provider know you have concerns. Option D. I know for sure nothing is wrong. The correct answer is option C. That sounds frightening. I can let the provider know you have concerns. An empathetic response acknowledges feelings and offers appropriate support without giving false reassurance. Dismissing fear, guaranteeing results, or discouraging questions is not therapeutic. Question 82. While following clinic policy, the medical assistant notes that a medical assistant reports a patient concern to the provider using SPAR. What does the S represent? Option A, sterilization. Option B, superbill. Option C, situation. Option D, supine. The correct answer is option C, situation. In SPAR, situation introduces the immediate issue being communicated. Sterilization, superbill, and supine are unrelated to the SPAR communication framework. Question 83. While following clinic policy, the medical assistant notes that a child has injuries that raise reasonable suspicion of abuse while following standard precautions. Which action is appropriate? Option A, post pictures online to get opinions. Option B, follow mandatory reporting and office policy immediately. Option C, ask the suspected abuser for permission to report. Option D, ignore it because reporting is uncomfortable. The correct answer is option B. Follow mandatory reporting and office policy immediately. Healthcare workers may have mandatory reporting duties when abuse is suspected, depending on law and policy. Ignoring signs, seeking permission from a suspected abuser, or posting information online is unsafe and inappropriate. Question 84. During a skills check, the scenario states that an office policy emphasizes avoiding preventable patient harm for a pediatric patient. Which ethical principle is involved? Option A, capitation. Option B, non-maleficence. Option C, downcoding. Option D, respondeat copying. The correct answer is option B, non-maleficence. Non-maleficence means avoiding harm and is central to safe healthcare practice. Capitation and downcoding are payment or coding terms, while the third option is not a valid ethical principle. Question 85. During a walk-in visit, a returning patient is involved when a clinic performs a rapid strep test classified as waived. What does waived testing generally mean? Option A. The test is simple and has a low risk of erroneous results when performed correctly. Option B. Only a physician may read the result in every setting. Option C. The result cannot be documented in the chart. Option D. The test never needs quality control. The correct answer is option A. The test is simple and has a low risk of erroneous results when performed correctly. CLIA waived tests are considered simple with low risk when instructions are followed, but quality procedures still matter. Waived status does not remove documentation, training, or quality control responsibilities. Question 86. A provider asks for assistance because a patient becomes angry about a long wait while prioritizing patient safety. Which response is best? Option A, threaten to cancel care immediately without policy. Option B, use a calm voice, acknowledge the frustration, and offer to check the status. Option C, mock the patient's concern. Option D, argue loudly in front of other patients. The correct answer is option B. Use a calm voice, acknowledge the frustration, and offer to check the status. De-escalation uses calm communication and problem-solving to reduce tension. Arguing, mocking, or threatening without policy can escalate the situation and harm the patient relationship. Question 87. A provider asks for assistance because a patient feels faint after a blood draw for a patient waiting for the provider. Which action is appropriate? Option A, help the patient lie down safely and notify the provider as needed. Option B, tell the patient to run outside for air. Option C, leave the patient alone in the chair. Option D, give insulin without checking blood glucose. The correct answer is option A. Help the patient lie down safely and notify the provider as needed. A faint patient should be protected from falling and assessed according to protocol. Running, leaving the patient alone, or giving unrelated medication can create harm. Question 88. After confirming the patient's identity, a conscious diabetic patient is shaky and has a low glucose reading. Which action is generally appropriate by protocol? Option A, administer a random antibiotic. Option B, give nothing and send the patient to drive home. Option C, provide a fast-acting carbohydrate if allowed by office policy. Option D, tell the patient to exercise vigorously. The correct answer is option C. Provide a fast-acting carbohydrate if allowed by office policy. A conscious patient with low glucose may need fast-acting carbohydrate according to protocol. Driving, antibiotics, or vigorous exercise can worsen the situation or fail to treat hypoglycemia. Question 89. When preparing safe patient care, a patient has a bleeding laceration while waiting for the provider after noticing a potential safety concern. Which first aid step is appropriate? Option A, remove large embedded objects aggressively. Option B, apply direct pressure with appropriate protection. Option C, use bare hands to hold the wound. Option D, apply heat to increase bleeding. The correct answer is option B. Apply direct pressure with appropriate protection. Direct pressure with PP helps control bleeding and protects the responder. Removing embedded objects, using bare hands, or applying heat can worsen bleeding or exposure risk. Question 90. In a medical assistant certification review scenario, a used venipuncture needle is ready for disposal for a new patient. Which practice is safest? Option A. Avoid recapping and dispose of it immediately in a sharps container. Option B. Place it in a coat pocket until the room is cleaned. Option C. Break the needle before disposal. Option D. Recap with both hands to prevent leakage. The correct answer is option A. Avoid recapping and dispose of it immediately in a sharps container. Avoiding recapping and placing sharps directly into the proper container reduces needle stick risk. Two-handed recapping, breaking needles, or carrying sharps in pockets are unsafe practices. Question 91. When preparing safe patient care, a patient is pale, cool, clammy, and confused after an injury. Which condition is a concern? Option A, otitis externa. Option B, shock. Option C, myopia. Option D, acne. The correct answer is option B, shock. Pale, cool skin, clamminess, and confusion after injury can indicate shock and require urgent response. Nearsightedness, ear canal infection, and acne do not explain this emergency pattern. Question 92. A medical assistant reviews a case where an AED is available for an unresponsive patient with no normal breathing during clinical workflow. Which action is appropriate? Option A, ignore the AED because it gives instructions. Option B, turn on the AED and follow its prompts while continuing emergency response. Option C, use the AED only after the clinic closes. Option D, place the pads over thick clothing. The correct answer is option B. Turn on the AED and follow its prompts while continuing emergency response. AEDs are designed to guide rescuers through pad placement and rhythm analysis during cardiac arrest response. Pads over clothing, unnecessary delays, or ignoring available prompts can reduce effectiveness. Question 93. During a skills check, the scenario states that a disinfectant splashes into a staff member's eye for a returning patient. Which first response is appropriate? Option A, cover it and wait until tomorrow. Option B, rub the eye hard to remove chemical. Option C, flush the eye with water or eye wash for the recommended time and report the exposure. Option D, use hand sanitizer in the eye. The correct answer is option C. Flush the eye with water or eye wash for the recommended time and report the exposure. Chemical eye exposure requires immediate flushing and reporting according to the safety data sheet and facility policy. Rubbing, delaying, or adding sanitizer can worsen injury. Question 94. A medical assistant reviews a case where a sterile tray is prepared for a minor procedure. Which action maintains sterility? Option A, turn away from the sterile field for several minutes. Option B, use items from a wet torn package. Option C, reach over the field with non-sterile sleeves. Option D, keep sterile items above waist level and within view. The correct answer is option D. Keep sterile items above waist level and within view. Sterile fields must remain visible and protected from contamination. Turning away, reaching over the field, or using compromised packages can contaminate supplies. Question 95. During a skills check, the scenario states that a patient with limited English proficiency needs discharge teaching after reviewing the order. Which approach is best? Option A. Ask a young child to interpret sensitive information. Option B. Use a qualified medical interpreter according to policy. Option C. Speak louder in English only. Option D. Skip teaching because interpretation takes time. The correct answer is option B. Use a qualified medical interpreter according to policy. Qualified interpreters improve accuracy, confidentiality, and patient understanding. Children, louder speech, or skipped teaching can cause errors and ethical concerns. Question 96. A medical assistant reviews a case where a Snellen chart is used during screening for a patient in the exam room. Which function is being assessed? Option A, blood glucose average. Option B, blood clotting time. Option C, hearing threshold. Option D, distance visual acuity. The correct answer is option D, distance visual acuity. A Snellen chart screens how clearly a patient sees at a distance. Hearing, coagulation, and glucose control require different tests. Question 97. A medical assistant reviews a case where a patient performs a pulmonary function test. Which instruction helps obtain a useful result? Option A, stop as soon as mild effort begins. Option B, seal lips around the mouthpiece and follow coaching for a full effort. Option C, chew gum during the test. Option D, breathe around the mouthpiece. The correct answer is option B, seal lips around the mouthpiece and follow coaching for a full effort. Spirometry requires a tight seal and strong coached effort for reliable measurements. Leaking air, early stopping, or chewing interferes with test accuracy. Question 98. In a medical assistant certification review scenario, ear irrigation is ordered for cerumen removal while maintaining privacy. Which precaution is important? Option A, aim forcefully at the eardrum. Option B, use very hot water to dissolve wax quickly. Option C, verify the order and screen for contraindications such as ear pain or perforation history. Option D, proceed even if the patient reports severe ear pain. The correct answer is option C, verify the order and screen for contraindications such as ear pain or perforation history. Ear irrigation requires appropriate order, temperature, and screening because perforation or infection can make irrigation unsafe. Hot water, forceful aiming, or ignoring pain can injure the patient. Question 99. A provider asks for assistance because a pelvic exam is being prepared for a teen patient. Which action supports patient comfort and privacy? Option A, provide appropriate draping and explain each step within the assistant's role. Option B, discuss private details loudly outside the room. Option C, leave the patient uncovered until the provider arrives. Option D, invite unrelated staff to observe. The correct answer is option A, provide appropriate draping and explain each step within the assistant's role. Draping and respectful explanations protect dignity and reduce anxiety. Unnecessary exposure, unrelated observers, and loud discussion violate privacy. Question 100. A provider asks for assistance because a patient's insurance requires approval to see a specialist. Which document or process may be needed? Option A, autoclave log only. Option B, inventory count sheet. Option C, medication lot sticker. Option D, referral. The correct answer is option D, referral. A referral authorizes or documents the need for specialty care under many insurance plans. Inventory sheets, sterilization logs, and lot stickers do not authorize specialty visits.